Perfect. Okay, good afternoon, everybody. Welcome to Healthwatch Hackney Information Exchange on liver health. My name is Sara Morosinotto. I am the Entry Review Manager at Healthwatch Hackney. For those of you who do not know about Healthwatch, we are the health and social care watchdog, and our job is to use the feedback that we receive from you, from the patients, to suggest improvements in the access to and delivery of health and social care services. We also provide the public with information about what services are available, hence this meeting today, and also how these services can be accessed. And we do educate our patients on their rights so that you can make informed choices about your health. And please let me introduce our speakers from today from the British Liver Trust. So we have with us Dr. Kathleen Bryce, who is a nephropathology registrar. I hope I've said that all right. Hello, Dr. Bryce, and welcome.
Hi, thank you.
And a warm welcome to Monica as well, who is a volunteer with the British Liver Trust and who's going to share a lived experience. And last but not least, we have Becky Pandolfino, who is the Outreach Development Officer. And welcome to you, Becky, as well.
Hiya.
So thank you for joining. Thank you for being with us today. We're going to start with Dr. Bryce, who will talk us through liver health. What are the things to look for and what to do if you have a concern?
Thank you very much. I will share my screen. And let me know if there are any issues. So thank you very much. I'm really glad to see some people here who are really interested. My name is Kathleen Bryce, and I've been a doctor for 15 years. I'm a gastroenterologist, so all of the gut, with a specialist interest in liver disease. And I'm about to become a consultant shortly. So thanks so much for being here. I'm going to talk to you about why you should love your liver. You can't live without your liver, and your liver does a lot of important things. So we'll talk about what it does, how it can go wrong, and how we can all prevent this, and perhaps when you should see your doctor. I won't go into a lot of detail about diagnosis and tests and treatment, but I'd be really happy to answer any questions about those things. So the liver, if I kind of stand up, put this on myself, oh, it's blurred. The liver is sits, as you can see on that diagram, above the stomach. It's about the size of a rugby ball. It's about 1.5 kilos. It is the biggest solid organ in the body. And at any one time, it holds about 1 pint of blood. So 13% of your whole body's blood is in the liver at any one time. So it's working really hard all the time, processing what we put into our body. All of the blood that comes out of the stomach and the intestines goes through your liver. So your liver is constantly taking in the nutrients that we want to absorb, and also alcohol or other toxins and medications that we put into our body and processing it. So here is a healthy liver, if you can see that there. What I might do is unblur my background, because I think that's what's causing a bit of an issue with seeing. I'll persist for now. Oops. Go back one slide. Yeah, okay. So a healthy liver looks like this. It's perhaps like the liver you might buy in the shops. Purplish, reddish, smooth in outline. So some of the things that the liver does. It helps to digest your food. So the liver in the bottom right-hand corner down here, it makes bile. Bile is a bit like fairy liquid. It helps, it's sort of an emulsifier. It helps to break down fat into little globules so that our intestines can absorb it. And then it stores fat in the liver, and it helps store carbohydrates, sugars as well, and it stores some important vitamins. So the liver is involved in storing energy and then also releasing energy. So carbs are stored as glycogen in the liver, and then if you need it, the liver can break that down to produce simple sugars, glucose. So it's involved in blood sugar control as well. The liver is involved in processing medication, so detoxifying, and also sort of processing medications that we use so that they can be effective in the body, and also processing alcohol. And the liver also makes lots of things. So it makes lots of important proteins, which could be hormones or enzymes, including things that help us to fight infections. So the liver has lots of different important functions, and it can sometimes go wrong with all these different jobs. Before we talk about how the liver can go wrong, it's important to just say that you might not know the liver is going wrong. So we'll talk about some symptoms, but importantly, liver disease doesn't always have symptoms and often can have no symptoms at all until the liver disease is quite advanced. And unfortunately, sometimes then there is a limit to what can be done there. So 3/4 of liver disease is diagnosed in quite an advanced stage, but most of it is preventable. So if we can be aware of the risk factors for developing liver disease, we can stop this process in its tracks before anyone perhaps ever develops any symptoms and develops serious liver disease. So some of you in the audience might be feeling very well and not think you have any liver problems, but it may be that you might want to think about how you can prevent getting liver disease, or think about seeing your GP to get tested if you might have any of the risk factors for liver disease. So for example, being overweight or developing obesity, particularly around the tummy, central obesity, having type 2 diabetes, drinking alcohol excessively, drinking sort of alcohol to a harmful extent. And then we can talk about some risk factors potentially for viral hepatitis, where you might want to get tested. So the take home here is we shouldn't really be waiting until we have possible symptoms of liver disease, because we can prevent it at an earlier stage. Now, some people with liver disease can have symptoms. They can have very significant tiredness or fatigue. Some people can develop generalized itching of the skin. And at a later stage, people might have jaundice, which is yellowing of the skin or the whites of the eyes. Some people can develop fluid in the abdomen, which we call ascites, or fluid around the legs, the ankles. People can have easy bruising and be more likely to have bleeding. But again, all these symptoms might come at a slightly later stage. 1 in 5 of us is at risk of liver disease, and that's why I'm really glad that you're all here today to learn a little bit more. So there are lots of different kinds of causes of liver disease, and it's not all about alcohol at all. We'll concentrate on the sort of commonest ones in the UK. So those would be the metabolic associated steatotic liver disease. So that means that's what we used to call fatty liver disease, or sometimes non-alcoholic fatty liver disease. And that's to do with the body's metabolism. It's usually related to being overweight and having diabetes, not always, but that's part of a combination of metabolic risk factors. Secondly, alcohol-related liver disease is common, and we'll talk about viral hepatitis, which is mainly hepatitis B and C. We won't go into depth about autoimmune causes of liver disease, which are really important, but less common, and other things like hemochromatosis or iron overload. Happy to answer any questions on those. So no matter what the cause of the underlying liver disease is, there's a sort of progression stages. So healthy liver, what I showed you before, purple and smooth, and be really good if we were in the room, because you can feel how sort of supple and nice and healthy this liver is. But anything that irritates the liver or causes inflammation or liver injury can over time develop liver stiffness and scarring. So if you imagine you scratch your hand, that will initially become a bit swollen, so inflamed, so red and sore and tender, but over time it will heal by scarring. And anything that irritates the liver is doing this throughout all the liver cells at a microscopic level again and again. And that can be reversible up to a point if the thing that's irritating the liver stops. But at some stage, it becomes not reversible anymore. So often these processes start with putting fat into the liver. So I have here a fatty liver. So you might be able to see there and maybe at the end I'll take my blur off in case there's been a problem here, but a fatty liver tends to be a bit paler, maybe less smooth, and sometimes on an ultrasound, a jelly scan, the liver can look quite bright. So being overweight, so having type 2 diabetes, can put more fat into the liver. Alcohol can too, as can some other liver conditions. Now, sometimes the liver reacts to having the fat there, or is reacting to a toxin like alcohol or a virus, perhaps, and will react by becoming inflamed. And sometimes that will then lead to scarring. And if those little scars keep going and develop and join up to produce bigger scars, we can get cirrhosis, which is severe liver scarring. Now, this liver has cirrhosis. And you might be able to see that the edge is quite knobbly. It's not smooth anymore. And the liver scars go together, and then in between the scars are these big nodules. So this is a cirrhotic looking liver. And that's important because the more scarring or stiffness there is in the liver, the worse the liver disease is and the worse the sort of outcomes are. So the higher is the risk of dying from liver disease. People who have cirrhosis are at risk of the liver failing, so not doing its jobs anymore, and also of developing liver cancer. So it's really, really important that we can detect liver disease when it's perhaps fatty or in the early stages of liver scarring, but not later when it's no longer reversible. Of those people who have liver cirrhosis, maybe 2-3% per year might develop liver failure or decompensation, so getting jaundice or swelling in the abdomen with fluid, and about 3-5% might develop a liver cancer. So we must prevent it getting to the cirrhosis stage. So we'll just discuss in order the 3 different conditions that are the commonest in the UK. So first, the metabolic associated steatotic liver disease. This means, well, these things are very interrelated, and liver disease can cause the other things and they can cause liver disease. These are interrelated. So it's related to having obesity, so excess fat around the abdomen, whereby that fat is directly coming into the liver through the big vein and developing, laying down more fat in the liver. It's related to problems with insulin secretion and insulin resistance and diabetes, closely associated with cholesterol and blood pressure, and then heart disease and cardiovascular disease and stroke. These things all go together. And it's important, if you find someone has fatty liver disease, to look at the other things too. So it's not all just about the liver, it's about the heart as well, and the brain and everything else. So close to 40% of the global population is overweight or obese. This is becoming the commonest cause of liver disease in the world. And about a quarter of the global population has fat in the liver, or MASLD, this condition. Of those, about a quarter get the liver actually becoming irritated because of the fat. And of those, a quarter go on to get the scarring and the cirrhosis. So it's not everyone, but you can see this is a huge number of people, and many, many of us are at risk of this. If you are obese, or if you have high cholesterol or type 2 diabetes, statistically over half of those people might have fatty liver disease too. So it's worth looking for in lots of us, actually. So in terms of preventing this happening, first of all, talking about healthy eating. I'll just go on to the next slide, which is the Eat Well plate you might have seen before. So this is well used and kind of well known. So with every meal that we have, or most of our meals, we should mainly be having fruits and vegetables and starchy foods and sort of complex carbohydrates. Then there should be a smaller proportion of proteins and dairies, and then the higher energy dense foods. So a sensible, balanced diet that doesn't have too many of the fatty and energy rich foods, perhaps limiting red meat to once or twice a week. There is good evidence that the Mediterranean style diet has benefits, even if you don't lose weight, has benefits in terms of reducing heart disease, strokes. And healthy eating and healthy lifestyle behaviours tend to have other benefits too, like improving your quality of life, mental health, and other things. So just to go back, first is healthy eating. Secondly, it's avoiding obesity. So you can easily look up a body mass index calculator online, and it just uses your height and weight. It's not a perfect calculator, but it can be useful, and you want to be between about 20 and 25 on that. Or you can do your waist to height ratio. So with a soft tape measure, measuring around the waist, around where the belly button is, that number of centimeters or inches should be less than half of your height. And if it's over 0.5, that is an indicator you might be more at risk of these metabolic syndrome things. So along with healthy eating, it's exercise. And what is recommended by physiotherapists and dietitians and experts is 2.5 hours per week of moderate activity. So that means getting a bit warm and feeling a bit out of breath, as a general rule, is moderate activity. And that could be 5 times 30 minutes of fast walking per week. Or it could be, if you're at an earlier stage, 10 minutes here and there, but making up to that total. So exercise has lots of benefits, even over and above weight loss. As well as cardiovascular exercise, there's good evidence that building muscle is really important too. So carrying the shopping, doing some light weights, doing some press ups against a wall, for example, building muscle is really important too. Avoiding smoking is really important for many different reasons. And checking up with the GP. So some of these things can only be sort of monitored by testing. So blood pressure monitoring, looking at cholesterol, looking at markers of diabetes. So moving on to alcohol-related liver disease. You don't need to be alcohol dependent to develop alcohol-related liver disease. Many of us drink more alcohol than is good for our liver and for our body in general. You don't need to have dependent drinking. That's something else that's also incredibly important, but many of us could be drinking more than we should do. Probably 1 in 5 of us drinks in a way that could potentially harm our liver, and that's more likely, you're less likely to get away with it if you also have diabetes or are overweight or have another liver condition. So alcohol is a common cause of liver disease in the UK. And as well as liver impacts, increases the risk of different cancers. So mouth cancer, esophagus, gullet cancer, bowel cancer, breast cancers. Alcohol also increases problems with mental health and accidents, heart disease and stroke. So many of us could do with looking at how much we are drinking. And that tends to be in terms of units. So a unit of alcohol is a measure of spirit. And in general, lots of alcohols that we tend to drink are getting a bit stronger. So a pint of 4% beer is actually 2.5 units. If it's a 5% beer, that's 3 units already just in 1 pint. And a bottle of wine, if it's 13% or thereabout, is about 10 units of alcohol. It's recommended that both men and women drink no more than 14 units of alcohol per week. So that's less than a bottle and a half of wine per week, for example. So to prevent liver disease developing, we should all be looking at different ways of cutting down if we do think we're drinking a bit more than that. So no more than 14 units in a week is recommended, and then allowing the liver to recover, to regenerate in between times. So having at least 2 or 3 days with no alcohol at all in the week, and it's best that they can be in a row, so consecutive days. So if you may be drinking more than this, there are lots of different ways of cutting down. So for example, starting off, if you're going to the pub or drinking with other people, starting off with a non-alcohol containing drink and then using that alternate drinks, so 1 for 1. Going for a lower percent alcohol, absolute alcohol ABV. And there are lots of different things that are on the market now, which are reduced alcohol, low alcohol sort of drinks that we can buy in pubs. Having a buddy and both of you together deciding to be drinking less, doing different activities, having a coffee, going for a walk, going to the cinema, etc. Different ways of looking at reducing our overall intake. It's worth speaking to your GP if this is something that you think needs to be addressed. Blood tests can sometimes show if there's some liver irritation there. not always. And it's recommended that we perform a special scan called a fibroscan, which is a special jelly scan with a probe on the outside of the skin, just over the ribs. It takes 5 minutes to do and looks to see if there's any stiffness in the liver, perhaps as a result of some liver damage or liver scarring over time. And it's recommended that if a woman is drinking over 35 units per week, or a man over 50 units, that we should be thinking about doing a fibroscan. And there are lots of different ways of doing that these days, and GPs will usually have a route into doing that. Those people who do have an alcohol dependence or a problem there are treatments available that can help with that do reduce the risk of continuing to drink harmfully. So finally, I'll talk about viral hepatitis B and C. These are blood-borne viruses that can affect the liver and cause liver inflammation, irritation, and scarring, and can lead to liver cirrhosis and liver cancers. Globally, worldwide, the commonest way of getting hepatitis B is mother-to-child transmission. So being born in a country where that viral hepatitis is endemic, so more common. And that's shown on the map on the top of the slide there. It is possible to get viral hepatitis from medical procedures, so injections or using needles or other equipment that haven't been adequately sterilised, or indeed blood transfusions or blood product transfusions in places where they don't test for hepatitis B and C. And in the UK, that's relevant that if someone has had a blood transfusion before 1996, we'd recommend getting tested for viral hepatitis B and C. And you may well have heard of the infected blood scandal that's been just reported on this year. Other risk factors for these blood-borne viruses would be injecting drug use. So that's even one injection of a drug back in the 70s, before we knew about hepatitis C, especially. So it doesn't need to be something that's ongoing. And these are not, these can be passed on through sexual transmission. They're blood-borne viruses, but there is a risk, a small risk of passing it on in that way as well. So with these, it's really about being aware that they exist and whether or not you might have any risk factors. Again, you may not have any symptoms, so it's all about getting a test. So GPs will be able to do blood tests for viral hepatitis. And indeed for hepatitis C, you can easily now order a free test online with this URL that I've put at the bottom here, where you'll get a blood test kit to your house and just do a quick finger prick and you can send that off and be tested for hep C. So if you are tested and are positive for hepatitis B and C actively now, there is excellent treatment available, which is curative in the case of hepatitis C, and in the case of hepatitis B, very effective treatment that can reduce the risk of developing liver problems down the line. In terms of prevention of both of those conditions, it's avoiding risk factors for picking them up. So with hepatitis B, there is a vaccination, which you can have if you have another liver condition or other certain medical conditions. You can be vaccinated against Hep B. If you are travelling to certain parts of the world, you can be vaccinated against Hep B, sometimes with a cost. If you are a healthcare worker in certain settings, and other people who have sort of engage in activities where there's a bit of a risk for passing on hepatitis B, you can be vaccinated then as well. And since 2017, all babies born in the UK are standardly vaccinated against hepatitis B, which is great. Treatment is straightforward. Wasn't always the case, but it is now, so it's well worth getting a diagnosis and then getting treatment if there are either of these conditions present. And there wasn't always that much good information for people who are affected by these, but there is now better information, and I've put some of the web links there. In conclusion, liver disease can and does develop without symptoms from preventable liver inflammation, for example, into serious liver disease. It's preventable and we should all be aware of risk factors. And so the take homes would be thinking about these potential conditions, considering if you have any of the risk factors, and getting tested if so. Thank you very much.
Thank you, Dr. Bryce. That was really informative and useful. And I love that you had the different livers with you and we were actually able to see them through the screen. That was lovely.
Good.
Thanks. Okay, we are going to carry on now with Monica. Thank you for joining us. Monica is going to share her lived experience of liver disease. Over to you, Monica.
So hello everyone. I didn't actually like the liver because having had the transplant, it sort of gave me quite a funny feeling. But no, on a serious note, so I had liver cancer, which ultimately led to a liver transplant just over 7 years ago. And almost everything Kathleen has said, I'm almost textbook for what she was describing. But so I was actually diagnosed on my 61st birthday. I mention the date because obviously it's a date that I won't forget for a long, long time. This was only a few years ago, but really and truly, I realised my journey started almost 40 years ago when my mum, God rest her, she passed away from liver cancer at the age of 62. It was really sudden, completely out of the blue. Because she died so suddenly, even though she was in hospital, an autopsy was performed, and she was found to be she was found to have hepatitis. Again, completely out of the blue. I was tested and found to be a carrier as well. So it's obviously come, as Kathleen said, mother to baby. My mum's passed it on to me unknowingly, unwittingly. At the time, the only advice given to me, or us as a family, was I was outwardly fit and healthy. There was no real cause for concern other than if I was in a medical setting, dentist, doctor, if I had to go to hospital, I needed to mention it. And both my children, if I had children, were vaccinated at birth. And that was roughly, so I just carried on with life as such. Fast forward then to I was just turning 60, and I just started to feel as if there was something wasn't quite right. I realised, sort of ladies of my age, it was probably menopausal, but there was just something still in the back of my mind. I was exactly as Kathleen said, I was excessively tired. I started to develop a little tummy. And what actually made me go to the GP in the first instance was I really was shedding my hair, but really shedding. She was very sympathetic, the GP. She ran a number of blood tests, mainly because of my family history, my mum having passed away, although there was no real connection at the time. She even sent me for a scalp biopsy, which, honest to goodness, it really hurt. And it was totally unnecessary, but, you know, such is life. The most recent blood test that she ran, it was just an anomaly that she wasn't too happy with. And again, because of my past family history, she referred me to a local gastroenterologist. There it was found my liver had started to harden and there was slight scarring. But this was quite a big shock to me because I didn't feel in any way unwell. And remember, this is a long time ago as well, before we had all this current information. The gastroenterologist referred me up to King's College Hospital. I went through, again, almost exactly as Kathleen said, I went through blood test, ultrasound, MRI, biopsy. It was the last test they performed on me. And they found a tiny tumour. It was just the size of a thumbnail, but it sat on my liver. So there I was diagnosed, as I said, on my actual 61st birthday with liver cancer. I was then referred up to the liver unit at King's. And although this tumour was tiny, it sat right next to the portal vein. So there weren't many options for me, unfortunately. So it was a portal vein embolization. Hopefully I've got that right, Kathleen. I always get that wrong. It was performed. And the idea was it was to tie off part of my liver, excuse me, with the tumour. And hopefully that will die. And as we all know, the liver can regenerate. I had that operation a few months later. Unfortunately, as soon as the operation started, much to the shock of everyone, including my own consultant, my liver was too cirrhotic. And now my only option was a transplant. This was, again, another huge shock, but I thought, okay, I'm at King's. This was all happening around me. It was just like this journey I was on. And I was listed while I was found to be suitable for a transplant. I was listed while I was in the hospital. And literally 13 days later, I have a call to say that there's a potential liver for me. Went in, the operation was performed on that day. It was less than 4 hours, which apparently is really quick for a transplant. You're warned it could be anything 5, 10, 11, 12 hours, depending on a lot of other stuff. Recovered really well. And I was in hospital for, I think it was 12 days in total. And because I'd recovered so well, it became quite, I just wondered, has this really all happened to me? But anyway, because the recovery was so well, I trained to become a pre and post transplant mentor for patients at King's. And what that brought home to me was there are so many different reasons in terms of the liver, going back to what Kathleen said, why somebody might need a transplant. But for me, it was being born with a hepatitis, not being monitored in any way, being really fortunate that my GP looked a bit further into what could have been causing this, and then also how quickly my diagnosis was made. It really was quite a roller coaster of an emotional ride. Also, then one of my follow-up appointments with the British at King's College Hospital, my consultant actually mentioned to me about the British Liver Trust website, because by now I really wanted to know more because it all happened so quickly. I know. So he put me onto their website, which I had a look around, and I joined one of their pre and post transplant groups, and that was really interesting and informative because there were other people, not just from King's, and again, there were so many different reasons why somebody could have a transplant, but they also had a liver cancer support group, which I joined. They also had a hepatitis B support group, which I joined. And I'm not just pushing the Liver Trust website, but honest to goodness, there's so much information on there. It was just enlightening for me, really. I started to become more involved with the British Liver Trust, realizing that my experience that I had could really benefit other people. And so I've been a volunteer for a while now. Apparently I was deemed an ambassador, which I quite like that title, but I really do. I'm very, very passionate about trying to dispel the stigma and the myth that goes with hepatitis B. And I firmly believe about people who are born with it or contract it, they should be monitored every 6 months, because had that happened to me, it's possible I may never have needed a transplant. Then I sit on the other side of the fence, how the early, going back to almost everything Kathleen said, the early detection of liver cancer. Getting that cancer diagnosis, any cancer diagnosis, I can't tell you. I mean, I'm not sure if anybody else has had to go through this, but it's such a shock. But it doesn't have to have the worst outcome if it's picked up early. And that's something I'm really, really, I want to spread to as many people as I can, really. And so when I was invited to join this group, this talk, I thought I must. Plus, I was actually born in Hackney. So in one way, this was almost, I was meant to be here today. It doesn't have to be the worst. And again, going back to the information on the British Liver Trust website, I believe it's just been published. There is an NHS paper, which I'm very pleased to say was the patient voice on, about the early detection of liver cancer. And that's something that is just, it's just almost a must. And yeah, I hope my own lived experience has sort of helped anybody here, be it through liver cancer, be it through the fear, be it of hepatitis B. Yeah, so I'm very grateful to be here 7 years on and being able to share my story with you.
Thank you, Monica, and we're very happy to have you. And I'm really glad that you know it's a story with a happy ending. It's good to know, and thank you
Yeah.
for sharing with us. Okay, so before we open up with questions, we're going to go on to Becky now, who is going to talk us through what support is available for those who have liver disease or who develop liver disease. Thank you,
Hi there.
Becky.
No worries. Can you see my screen? Lovely. So I won't kind of drone on for too long. But basically the British Liver Trust, we look after anyone in the UK with a liver illness. That could be anything from a small child born with a problem with their liver genetically, through to someone who gets autoimmune hepatitis or some of the diseases that obviously Dr. Bryce was talking about. We don't exclude, we include everybody. So we're made up of three little strands. There's the British Liver Trust, and then we also have Liver Cancer UK, which is like a little separate section, and also the Children's Liver Disease Foundation. And that's because patients that are very young and also patients with liver cancer sometimes have specific needs. So we feel like they benefit from having their separate sections, if you like. We recently merged with Children's Liver Disease Foundation, and we developed ourselves Liver Cancer UK in April 22. So what we do, I'm just going to move straight on. This kind of links in a little bit to the gentleman, Harvey, who asked a question earlier about myths around liver disease. So a lot of people thinking that their liver regenerates. Obviously, Dr. Bryce will probably comment more on that in a bit. People thinking that if they just do dry January, they'll be okay. But actually what we see is that liver disease is continuing to affect and have poor outcomes for people year on year, whereas cardiovascular diseases, diabetes, really positively, the death rates, if you like, are declining, which is brilliant. We're not seeing the same thing for liver disease. And also, linking again to Harvey's question, most people associate liver disease with alcohol misuse. And although there is a big link, it is absolutely not the only reason that people get liver disease. And that is probably one of the most challenging misconceptions or stigma that people with liver disease face. This is the really sad graph that we always go on about this graph, because it really nicely shows how more people are dying now from liver disease, 4 times more, in fact, than they were in 1970. And that is also accounting for changes in population size. So it's not just more people are dying because there's more people in England, it's more people are dying now per section of population. So it's actually quite a bit of a wake-up call, really. And after suicide, it is the second leading cause of premature mortality in England and Wales. And what we see as well is that people in more deprived areas of the country are more likely to suffer and have poor outcomes from their liver disease as well. So we provide a lot of support to anybody with a diagnosis of liver disease, and we do that in lots of different ways, which I'll just kind of run through with you in a second. But the other thing that we do is we try and help the general public to make better choices about their liver, regardless of whether they have a liver disease or not. So kind of like what we're doing today, maybe some of you are here because you're worried about liver disease, or you're caring for someone and you're worried about liver disease, or you just want to learn more about it. So we have 2 sides to us, really. The side to help the people that know they have something not quite right with their liver and supporting those people, and then the other side of looking after the general public and hopefully, following on from Dr. Bryce's nice diagram there, helping people to stop their liver going all the way along that scale to the irreversible damaged end. Basically, we want people to either not damage their livers at all or damage them a little bit, and then we can support them with the medical professionals to reverse the damage. So these are, as exactly Dr. Bryce mentioned, that we didn't get in cahoots about this, actually. So I didn't see Dr. Bryce's slide, and she hasn't seen mine. So this is, you know, providing more evidence that this is the number, like sort of 3 top preventable liver issues, really, the same exact ones that Dr. Bryce went through. So I won't go through them again in detail, but they are obviously alcohol misuse, non-alcohol related fatty liver disease, which has been rebranded as MASLD. So I need to change that on the slide. But the disease itself hasn't changed. That's the one that links into your metabolism, diabetes, overweight, etc. And then obviously viral hepatitis as well. So exactly as Dr. Bryce said again, so again, I'm not going to repeat this, but you can see the diagrams there. So exercising, these are the ways that you can really support your liver. Keeping a check on your drinking, so the 14 units, which is, as Dr. Bryce mentioned, no more than a bottle and a half a week. And ideally, we would always recommend not to drink every day of the year and then just do dry January. We'd recommend consistently 2 or 3 days a week or more in a row where you don't drink, because that really gives your liver a nice amount of time to regenerate. Nice, healthy diet. And sorry, I'm just going to move you guys across. And then for viral hepatitis, as we said, so sensible choices in the way that you interact with others. So just common sense things that we hope most people do anyway. So using condoms during sex, getting an STI test before, you know, you make a decision with a new partner. Again, though, hepatitis is not all about, it's not all about STIs. Exactly as Monica said, you know, young babies can be born with this. And this is why we're reducing, trying to reduce stigma around it, because what we're finding is that some young people don't want to talk about their worries about hepatitis because they're worried that in their families will think that means they're having sex. And it doesn't. It literally does not even mean that 1%. You can be born with hepatitis because of a myriad of reasons, which we've discussed today. And you can pick it up if you're bitten as a toddler at daycare by a child that was given hepatitis accidentally at birth, and then that child bites your child at daycare, the toddler can contract it. So it's absolutely not all about people making unsafe sex choices or even having sex. So just to make that really, really clear. So moving on then, so how we support you. If you have a worry, even if you don't have a diagnosis of a liver condition, you can phone our nurses, a little bit like the wonderful charity that is Macmillan. We have a nurse-led helpline where you can ring us during the week 9 to 3 and you can talk to a nurse about your liver. You'll be speaking to a liver specialist nurse. And they can reassure you or direct you, or, you know, you can call for any reason. It could be that you've got an appointment with a consultant coming up and you're frightened and you don't know what to say. They can help you write questions. It could be a carer despairing because their partner's still drinking and they shouldn't be. It could be anything. So please, you know, make use of that. We also have loads of free resources, as Monica was talking about, and they are written in a way that the general public would find easy to understand. We have virtual support groups. Again, Monica mentioned those. So the outreach team, which is me and my colleagues, we run those virtual support groups. And you might see us out and about in the community. So we go to events, we talk about liver health. Monica goes up to the MPs in London and speaks to Parliament. You know, and talks about her experiences. So we work with the government influence policy as well. And sadly, you know, liver cancer is one of the less survivable cancers. So we are involved in strategic planning around that, encouraging people to get their surveillance scans done. But just a couple of things. You'll see the Liver Cancer UK looking slightly different. There's our nice logo there, but it is all part of the British Liver Trust. So if that's something you want to find out more about, Liver Cancer UK, we obviously run that as well. And again, you will see the Children's Liver Disease Foundation now on our website. Just a couple of things. there is a number there. I can always ask Sarah to share that number, but that will be on, this presentation, and also on our website for contacting the nurses. I'm going to skip through these little bits, actually. Roadshow is very important. I will notify Sarah. We go out into the general public and we do the fibro scanning. So it means that you can get your fibro scan done without a GP referral, without a wait. So get there early in the morning when you hear that we're in the area, get your fibro scan done, and then you'll be directed into NHS pathways if there are concerns based on our fibro scan. So for some people who think they probably do have a liver problem and are worried about waiting 6 months for a scan, if you find out that we're in the local area, there's no cost, you can turn up, have a scan, a bit like when you give blood and they turn up in a truck, and you can expedite your scan that way. We do a screener. So please, when we finish this, if you or someone that you know is at risk, or you think they're at risk of liver disease, go onto our screener. You can just type in British Liver Trust screener, and it will ask you a series of questions, and it will give you an indication of how well you are looking after your liver. And it could be a good way of initiating that conversation with a GP to say, look, I've done the British Liver Trust's liver screener. It's suggesting that perhaps I might need to speak to you about my liver health. It kind of gives a way into that conversation, and they can send you for blood tests and, if needed, a scan. Also, because you guys live in London, and I have triple checked this, you can get a Hep B test kit posted to your house for free. So this is in addition to Hep C, which Dr. Bryce was mentioning. They are two separate diseases. Just because you don't have one, it doesn't mean you don't have the other. That's like saying, oh, I don't have Hep B because I've had COVID. Like, they're not even linked one tiny bit. So you would need to rule out both of them. So it's two separate tests. So if you're worried or embarrassed or frightened to speak to your GP about this, you can just go on Sexual Health London. As long as you're over 16, you don't need to be referred. They will send you a little kit in the post that looks like that. And a little aside there, they won't automatically test you for Hep B. It depends on the answers that you put in. So no one is going to check those answers or tell anybody what you put. But that's just kind of, they won't automatically, test you for Hep B, but you can fill in the questionnaire, get a Hep B test to your house. It's a little pinprick, like a diabetes blood test, blood sugar test, pop it in the jar and send it off. And it comes back on an app in about 2 or 3 days to tell you, hopefully, the good news that you're all clear. And that is everything. That is the British Liver Trust. So thank you for listening. And if anybody has any questions, I'm going to hand back briefly to Sarah. But if anyone has any questions, I'm sure we, between us, love to be able to answer them for you.
Thanks. Thank you, Becky. As a very thorough overview of the services and supports that you offer. Thanks. So I do have a couple of questions that people have sent me in a private chat, and we start with these and then I'll go and have a look. I can see that Harvey has typed quite a lot of questions. So one of the questions says, English is not my first language. Do you offer an interpreting service?
Yeah, we do at the British Liver Trust. So if you phone up our nurses, they can dial into language line and you can have a 3-way call with language line and the nursing team. We're also translating all of our publications into 140 different languages, but it's quite a big job. But I've been told it's imminently happening. That's what we've been told. Before it was like next year, and now we've been told it's imminently happening. So I will notify services when that happens as well.
Perfect. Thanks. Thank you. And then the other question before I go to the chat, Are there any financial assistance programs or resources that are available to help manage the costs associated with liver disease?
We run finance living well sessions and provide strategies and ideas about how you can overcome the financial hardship associated. Obviously, probably not the forum to go into too much detail, but absolutely you would probably, depending on your diagnosis, there are government and universal credit options available. One of the ones obviously that's more well heard of is the PIP system, which if you're not able to work, you should be eligible to claim PIP, which is basically disability living, but it's called PIP now. So that's one thing there. But we do have a financial section on the British Liver Trust website, so please do check that out. There might be tips and things that will help you on there.
Thank you. I thought I got you off guard with this one, but you're very well prepared. You've got it all covered. Thank you, Becky. Okay, let's have a look at the chat. So I think some of these questions have been actually answered during the talk, but do you want to quickly recap, maybe for you, Dr. Bryce, do you want to quickly recap the biggest misconceptions that people have about liver health?
I think mainly people don't always consider their liver and liver health to be a priority. As Becky said, the causes of death from stroke and heart disease are going down over time, and from liver disease, they're going up and up and up. We don't often consider, but advanced liver disease sometimes has a worse outlook than some kinds of cancers, and that's not known very well in the general public. And that's really important. So thinking about liver health at all, I think, is a major barrier. Considering that liver health and liver disease is not all about alcohol, is another important thing, as Becky said. And just not being there's sometimes a bit of a sense of nihilism or hopelessness. You know, some people they come to see me and they're really worried that they're drinking too much, for example, and they assume that they probably have liver cirrhosis and they probably don't have, there's no point in stopping now. But actually, no, at all levels of liver disease, there is hope and there is reversibility that can happen, and improvements in quality of life no matter where you are in the spectrum. And often people will have a fibro scan and realize that things are not as bad as they had assumed, and there's a lot to be gained from intervening then.
Thanks. Thank you, Dr. Bryce. And then there's another interesting question, which I think would be for you again, which is, are there any promising new treatments or therapies that are in development? So we're looking a bit at the future here.
Yes, there are. Brilliant question. So to start with the MASL, the metabolic related liver disease, there is lots and lots of research going on, and every conference there's a big new result from a big trial. So a lot of those relate to some of the medications that you might have heard of that are used for diabetes or for weight loss. So these GLP-1 agonists, or sometimes called semaglutide would be the commonest one. You might have heard of Ozempic or Wegovy. So people are looking at that in detail, and that can improve liver inflammation when there is excessive fat in the liver. But in terms of reversing the scarring and going backwards from scarred to non-scarred, that's where a lot of attention is focusing now, and there's lots of interest coming through there. It may be possible with metabolic associated liver disease to go back from scarred to less scarred, which is really exciting. To take alcohol, that's really, unfortunately, a huge unmet need. There aren't really any good treatments except for all the different ways that we can support people to reduce alcohol use. For people who are alcohol dependent, there are some good medications that can reduce cravings, and in different ways help to reduce alcohol use, but a lot of it is linking in with perhaps talking therapies and general life support. And then finally, with viral hepatitis, in the last 15 years, there's been a huge revolution in hepatitis C. It's now completely curable just with tablets, no injections, in 8 to 12 weeks. So just 2 months or 3 months of an oral tablet once a day with over 95% chance of cure. So that's huge. Hepatitis C doesn't need to affect anyone anymore. With hepatitis B, there's lots and lots of interest in getting a cure. Really sadly, there isn't a cure at the moment, unless you have a liver transplant. But there are really good medicines that reduce any liver irritation, so can massively reduce the chance of ever running into liver cirrhosis or liver cancer. So that should not happen now for people with hepatitis B either, because there's treatments around that are really working. Lots of interest.
Thank you. So a good message of hope from the medical research as well. Thank you. Right, I am gonna say, oh, there was a question from Ivana. Thank you, Ivana. It says, is there a big rise in children with liver disease because type 2 diabetes is more common in children now?
Yes, I don't know that much about the numbers, but yes, the prevalence of overweight and obesity and diabetes in children and adults is going up in a really, really alarming way. And yes, also liver disease as well. And I don't know much about the children population, but certainly in young adults, particularly women, seem to be more susceptible. We are seeing that, sadly. So yeah, it's a huge concern and needs to be attached. Needs to be treated not at the late stage of getting liver disease, but really in a public health sphere. It needs to be tackled that way.
Thank you. And I think we'll close with one more question and then we're going to stop because I want to be respectful of everybody's time. Can you request a liver screening from your GP without experiencing symptoms?
Absolutely. Don't wait for symptoms.
By the time you get to symptoms, it's too late, isn't it? Or it could be too late.
Yeah. All you need to say is, I want to look at my liver health. You don't need any follow-up. You can also give the follow-up risk factors that you might be concerned about. Absolutely.
Thanks. Okay, well, thank you to the British Liver Trust, Dr. Bryce, Monica and Becky, and thank you to all of you who joined us today and to those who are going to watch this in the future on our YouTube channel. I will get in touch next week with the link to the recording. Thank you and have a really good evening, everybody.
Thanks for coming, everyone. Thank you.
Thank
Bye,
you.
everyone.
Bye.
Bye. Bye.